Are you considering having an aesthetic procedure performed? Confused by all the information out there? Welcome to It's a Young Thing, where Nurse Paula Young arms you with the knowledge on all things cosmetic and aesthetic. And now, Nurse Paula Young.
Hey everyone, it's Nurse Paula. Thanks so much for joining me again this week. And you know, here on the East Coast, we're caught in wintertime right now with dry, frigid air. In fact, I think they're calling for temps up to or down to 18 degrees this weekend. And you know, what do? We just freeze. And, you know, this time of year for us East Coasters has to do with, or is a big cause of dry skin. It's one of the big things that we notice this time of year. And a lot of people really are kind of going about it the wrong way for treating their dry skin. So I wanted to talk a little bit about that, like some of the other reasons that cause your dry skin to occur. So, one thing, last week I was fooling around laughing with my producer, Steve. We were talking about all these things that fail us as we age. And I was like, sure enough, I'm going to have something else that fails us. Well, guess what? Aging causes dry skin. I have to put it out there. Aging causes so many things to happen to our bodies. It's sad. It's just sad. So when you age, when your skin ages, your hormone levels are changing and it causes your skin to thin out and to dry out. And it's just really hard to get that moisture back in. So one of the things that for aging skin that we recommend people use is a moisturizer that's really rich in alpha hydroxy acids or maybe some retinols for the face. And we had a podcast previously on Tell Me About Retinols, and the retinol products is really one of the best things that you can use for aging dry skin of the face. It really is. And you also want to use a special moisturizer if you have oily skin, aging oily skin. It is possible. You can have dry skin and have oily skin at the same time. A lot of people, strip that oil off and your skin needs that. That's not really what moisturizes your skin, but it really does help to protect your skin. So another condition that can bring about pretty bad dry skin are certain medical conditions. And I'll give you an example, we're talking about flaking skin versus scaly red patches, raised patches. These can be skin conditions such as atopic dermatitis or psoriasis. Even diabetes can bring about certain skin conditions and rashes. There's shingles, and even hypothyroidism can bring about certain skin conditions. So, if you have something that's really kind of red or scaly or itchy or raised, you really want to get yourself to your doctor or to a dermatologist. You want to make sure that you don't have some sort of skin condition going on, and perhaps you may need a topical anesthetic, or not anesthetic, a topical product or antibiotic or prescription creams or even oral medications to help with certain skin conditions. I know psoriasis can be a very, very, very painful type of skin condition that really does need to be medically managed. Another thing that can cause dry skin are certain allergic reactions. You can have an allergic reaction to laundry detergents or soaps or shampoos or fabric softeners or perfumes. You can even have an allergic reaction to certain kind of fabrics. So one of the fabrics that we recommend to people who have types of allergies to like polyesters and knits and things like that is cotton blend fabrics, not only in your clothing, but also on your sheets, on your bedding as well. So if you have introduced a lot of new things and you're still getting a red dry skin, you might want to just start eliminating one new thing at a time so you could try to figure out what the culprit is. You have no idea which one it is. Okay, let's talk about another reason that you could have really dry skin is if you're an over exfoliator. I mean, it's great to exfoliate your skin. We talked about how the skin cells turn over about, like every 10 to 14 days, and you really want to get that top layer of dead skin cell off called the stratum corneum. It's great, but some people go nuts with exfoliating. They'll go in the shower and they'll use, like an abrasive sponge, and they'll put some, those little beads on top of it, and they just scrub. And they're just really over drying the skin. It actually makes the dryness worse. So mild exfoliation is the key here, not over scrubbing your face. Using your hands or a softer kind of washcloth instead of a real abrasive brush or not brush, but sponge is really the best thing. Is just try to, limit your exfoliation to maybe once a week if you really have to do some heavy duty exfoliation. And we already talked about the lovely East Coast winter weather that we have, and the cold weather. What happens is the humidity outside drops and it causes our skin to dry out. So what do we do when we get cold? Then we go in the house and we crank the heat up. Well, that does the same thing. Did you ever notice in the wintertime how the floorboards, if you have hardwood floors, they separate during the wintertime because you've turned the heat on and it's desiccating the wood. It's drying the water out of the wood and the boards kind of like shrink up and separate apart. Well, if it's desiccating your hardwood floors, it's desiccating your skin. So keeping your home temperature at about 68 degrees is optimal for not ripping the moisture out of the air or out of your skin. Installing a whole house humidifier, and if that seems to be too of an expensive type of remedy for your dry skin or dry floors, then just even room humidifiers. You can get room humidifiers and they can moisturize the air in like a large living space or even just your bedroom at night when you're sleeping. It's great not only for your skin, but it's great for your nose and your mouth and your throat, and it helps put moisture in those dry areas as you breathe when you sleep at night. So if you're going outside during the winter weather, use a lip balm. Protect your lips as well. I like to recommend a lip balm that has an SPF of 30 or more in it. Sometimes you find it with 15. That's even good. But you want to cover your lips not only with a nice moisturizing lip balm that has emollients in it, but a sunscreen as well. And, cover your neck with a scarf and cover your hands with gloves. Any exposed area can really help to cut down on dry skin. Now, I know you're going to hate to hear this, but boy, do we love our hot showers. And a hot shower really, it feels great and it's relaxing, but it dries out your skin. It really does. The longer that you're in the shower, the more you're drying your skin out. Now you don't need a cold shower. That's for other reasons out there, but I'm talking more of a lukewarm, tepid kind of shower, not a scalding, steamy, hot shower to where your mirrors in your bathroom are fogging up and it's, you can't even see and you can't even breathe. Those are the kind of things that really do dry out your skin. So, and when you get out of the shower, one of the best things you can do is people towel dry off completely. And we recommend, just damp dry yourself. So there's like a little bit of like a dewy mist still of the water on your skin. And then go ahead and apply your moisturizer. If you have really dry skin, we recommend sensitive skin moisturizers that really aren't loaded with perfumes in them. One with an SPF 30 or more, especially in exposed areas like your arms and neck and chest that might be sticking out of your clothing a little bit. Those moisturizers are great. And when you put the moisturizer on over top that little bit of a dewy wetness from the shower, it really does lock the moisture into your skin and it creates an effective barrier for the harsh winter elements. So do not use a body moisturizer on your face. You really want to use a moisturizer that's non-comedogenic, and that means non-pore clogging. You'll see that on the label. It means it won't clog your pores, and that is one of the biggest differences between body moisturizers and facial moisturizers is that facial moisturizers are made to hydrate your skin. And they're not made to clog your pores that can cause enlarged pores and blackheads and breakouts and little milias and little whiteheads and things like that. So definitely use a facial moisturizer well. So, you really want to take all this into consideration. A lot of things can bring about dry skin. And the main thing that you need to do is just don't exacerbate it with the hot showers and the over exfoliating and things like that. That's just kind of like overkill. So that's pretty much all I have to tell you on dry skin on It's a Young Thing this week. It's something that we see a lot of, especially when people come into our office at Young Medical Spa. They come in for facials, they come in for chemical peels, they come in for microdermabrasion. And these are treatments that can help exfoliate professionally. But usually, I mean, if you ever come in and you get these procedures done, you'll see that the esthetician afterwards will moisturize your skin, and they'll also put sunscreen on it to protect it as you leave the office. So that's pretty much standard of care for facials and chemical peels and microdermabrasion and a medical spa. So that's everything for dry skin on It's a Young Thing. Thank you so much for joining me this week. You can subscribe to my podcast on iHeartRadio, iTunes, SoundCloud. It's even available on our website at youngmedicalspa.com. Thank you so much, everyone. We'll talk to you next time. Bye-bye.
You've been listening to It's a Young Thing with Nurse Paula Young. If we didn't discuss a topic you're interested in today, be sure to subscribe to our podcast on iTunes so when we do, you don't miss it. The cosmetic aesthetic world can be confusing. We're here to arm you with quality, truthful information from our many years of experience. For even more info, youngmedicalspa.com.
This has been a Steve Mittinen social media creation. Steve Mittinen, socialmedia.com.
The creators, producers, participants, and distributors of this podcast disclaim any liability in connection with the material expressed herein. This information should not be substituted for individual medical counseling. Information on this podcast is not intended to diagnose or prescribe treatment for any condition. It is intended for educational purposes only, based on the research and experience of Young Medical Spa. Discussion of specific treatments is done only in an office visit directly with the patient. Contact our office to schedule.